I'd like to introduce Terry Killip, who's a registered nurse who works with stroke patients in the community. Terry, what does a community nurse do?
Well, first of all, there are a variety of community nurses, but essentially a community nurse works and provides nursing care to patients in their own home. So there are a number of different roles in the community. There might be nurses who specialise in different roles, such as continence nurse specialists, or stoma nurses, or respiratory nurses. There are district nurses who work in the community and they undertake a variety of tasks really in their job. Then there are also community stroke nurses in the areas that are fortunate enough to have community stroke services. And community stroke nurses coordinate care for stroke patients in their homes, and they help smooth the transition from hospital to home.
If I need a community nurse, how do I find one?
Well, the best way to access community services is to be linked in with your GP. That's the primary kind of link that people need in the community. Then you have GPs practice nurses, and they can refer you on to district nursing services. They can refer you on to the community stroke team, and they can refer and make sure you get linked in with the services that you need.
We've heard how no stroke patient is alike, that it's a complex disease and people have different needs. How would you know what my needs would be?
Well, we assess you. Nurses are very good at a holistic assessment of people and what their needs are. They look at the whole person, not just their physical, but they also look at their mental and spiritual needs and see how that stroke impacts them. So it's a needs-based assessment in the home.
And I don't feel I've got the support I need. How can a community nurse help me?
Community nurses just form part of what you need for your support. There are other services that a community nurse would link in with. It all depends which area you live. There's needs assessment services, and they are another group of people that will come and visit you in your home, determine what your needs are. Some people might need some help just with showering and dressing. Other people might need help with their housework. But we always aim to support people in their own home for as long as possible, if that is where they want to live.
And I don't feel I've got the support I need. How can a community nurse help me?
Community nurses just form part of what you need for your support. There are other services that a community nurse would link in with. It all depends which area you live. There's needs assessment services, and they are another group of people that will come and visit you in your home, determine what your needs are. Some people might need some help just with showering and dressing. Other people might need help with their housework. But we always aim to support people in their own home for as long as possible, if that is where they want to live.
After a stroke, I may have some disability, and I might be conscious of that disability and a little bit embarrassed about it and don't feel like going out and mixing with the community or seeing my friends anymore. What's your advice for me?
My advice for you is to be aware that you can get depressed after a stroke, that it has had, for some people, a big change in their lives. Some people might have a very mild stroke, might not have a big impact. For some people, it is a bigger change. They can't drive anymore. They can't get out and do the things that they used to do. And they're at risk of feeling depressed, feeling isolated, and feeling socially abandoned. So my advice to you would be to maintain the social networks that you had before you had your stroke. Some people have social networks in place. They belong to church groups, they belong to social groups, service clubs, sports teams, and they're kind of linked into people in the community. And if they can maintain those links to some degree, it will help them avoid those feelings of isolation and depression.
Is there a place in the community where I can meet other people who have also experienced a stroke?
There are. Some stroke associations or stroke foundations might have stroke clubs where other people will go who had a stroke, and they meet for mutual support because they all have experienced a stroke. They all know what it means and what effect that it's had on each other. So they go there for support, they go there for social activities, some education, some exercise. It's also very good for a bit of time out for the caregiver of the person that's had the stroke. They know that they can safely leave their stroke person in the hands of the people at Stroke Club. They know they'll be looked after, cared for. Then the caregiver can have a little break away.
What services are available in the community to help a caregiver look after a person who's experienced a stroke?
Well, there are a number of services. There is caregiver support groups that are run by the Stroke Foundation, and they're an opportunity for caregivers to meet together and talk and share and vent how they feel about caring for a stroke patient for 24/7. There are also some private providers who will offer daycare programs for stroke patients. Sometimes they have a cost attached to them, but it is often minimal and affordable, and that gives another opportunity for some time out for the caregivers. There are respite programs, which is offered through the Carer Support program, which is offered through the Needs Assessment Service, where people can have 28 days or more respite, and the caregiver is in charge of that respite care, and they decide how they want to use it and when they want to use it, and that can give them a time away up to 28 days a year.
With people who've experienced a moderate to severe stroke, they can be reasonably disabled, which means that they can't move around like they used to. How important is it to look after the skin?
Very important to make sure that you are able to move around in bed, which is the area where most people will develop a pressure area on their heels or their back from lying immobilised in bed. So important to learn to move, important to know the importance of moving in bed and changing position, important to know how to position yourself or your loved one carefully in bed using pillows for support. Importance to know how to turn regularly, especially for those people who've had a severe stroke and are quite disabled.
Some people who've had a stroke notice that their balance and coordination isn't like it once was, and they may feel that they're at risk of having a fall. Have you got any advice on how to prevent a fall?
If they are at risk of falls and their balance is affected, they should have been provided with some kind of walking aid before they leave hospital. It's important that they use the aid that they're given, and they will have been assessed for the correct aid for their height and their need. It's important you don't park it in the corner of the room and hold on to the furniture to negotiate your way around. Use the equipment that you're given. Then there are sensible precautions like the mats on the floor, making sure they're not loose, making sure that electrical cords aren't in the way. So you do all of that kind of minimisation of your falls risk. If you're really at risk of falls, the geriatricians might well advise hip protectors to use in case of a fall. They are a very good device, and that will increase someone's peace of mind if they really are at risk of falling.
They just sit on the edge of the hip, is that right?
They
so
do.
If you fall, they take the impact.
They do,
Right.
incorporated into a pair of underwear. Very well researched, well tolerated by people that wear them, and they really do reduce the risk of having a fracture on top of your stroke.
I've seen on television advertisements for these alarms that look like watches, or you can wear them over your neck. How important are they for somebody who's experienced a stroke?
Well, again, it's up to people to decide whether they need them or not. We often advise people to invest in one, and they don't always have to pay for them themselves. They can use their benefits to help pay for it. For people who are on their own, or who are on their own for portions during the day while their caregiver is away, they can give great peace of mind that someone will be there at the press of a button, and there are different services and different providers who will respond to the alarm call in different ways depending on the arrangements that you've made. But as a peace of mind investment, they're very valuable.
Thank you very much, Terry.
My pleasure.